Have you been diagnosed with Hashimoto's or hypothyroidism, but you're still experiencing things like fatigue, constipation, and weight gain? You may be on the wrong thyroid medication, and honestly, you may not need to be on thyroid medication at all. In today's video, we're gonna go over the difference between Hashimoto's, which is an autoimmune disease, and hypothyroidism, which is a hormone deficiency, and we're going to help you to decide whether you need to be on medication, and if you do, what's the right medication for you. Do you still feel tired, anxious, maybe just generally unwell and off balance, but you're taking thyroid medication for your Hashimoto's or hypothyroidism? You are not alone. Many people are on the wrong thyroid medication or shouldn't even be on medication to begin with. In today's video, I'll explain why that happens and what to look out for to make sure that if you do need medication, you're on the right one. Welcome back to the Dr. Britnei channel. I'm your other doctor, and I help you to decode your blood work so that we can manage dis-ease from a root cause perspective. Let's get started. Do you actually need thyroid medication? So many patients are diagnosed with an autoimmune disorder called Hashimoto's, and their physicians assume that the way that you treat Hashimoto's is with thyroid replacement therapy. So what they're doing there is they're assuming that you have enough destruction of your thyroid to have created what we call hypothyroidism, and now you need to be on a medication to manage those hormones. However, Hashimoto's does not automatically equal hypothyroidism. In fact, when you have Hashimoto's, you can actually flare in either direction. You can end up hyperthyroid for a period of time and then hypothyroid for a period of time as well. So it can become a little bit dangerous if you're constantly prescribing a thyroid hormone replacement therapy for someone with autoimmunity if you're not taking into consideration how the autoimmune disorder affects your thyroid function. Treating Hashimoto's with thyroid medication alone is never the answer. Autoimmunity requires a really deep dive into what triggers your specific immune system. That means that we can manage flaring from a root cause perspective. You can't actually destroy thyroid tissue if you don't have inflammation in circulation. Let's talk a little bit about what Hashimoto's is and how that reaction occurs in your body. When you have antibodies created against something called thyroid peroxidase, which is what gives you the name of Hashimoto's, your body is using antibodies, which normally would be directed against things like viral proteins, to destroy tissue in your thyroid. This destruction cannot happen if you don't have enough inflammation in circulation. So think about antibodies as kind of like little laser beams. They're tagging your thyroid. There are these little red flags in your thyroid telling your immune system, we don't like this. We don't like this enzyme called thyroid peroxidase. Even though everyone has thyroid peroxidase, and it's a naturally occurring enzyme that is absolutely required for converting our inactive thyroid hormone into active thyroid hormone. When your body loses what we call self-tolerance, it starts an autoimmune reaction, an inflammatory reaction against something that is naturally being produced in our body. In Hashimoto's disease, this is an antibody against thyroid peroxidase. When you start destroying that particular enzyme, you end up with less and less active thyroid hormone, and you end up with enough thyroid destruction eventually that you have to go on some kind of hormone replacement. You cannot, however, cause this destruction if you don't have kind of the ammo in circulation. So your body can stick as many little red flags as it wants to into your thyroid. But if you don't have enough inflammation in circulation to cause damage, to respond to those red flags, then we can actually put you into remission. The antibodies are not what do the destruction themselves. They are merely placeholders for the white blood cells that they're attracting. If we reduce inflammation in the body, which requires identifying unique triggers for each patient, then we can reduce the amount of tissue that's damaged, and we can also reduce the amount of time that you spend in a flare. Hormone replacement therapy like T4, levothyroxine, Synthroid, and even T3 medications like Cytomel, or combo medications like Armour and NP thyroid, or even just a glandular medication, do not address this autoimmune issue. The only way to address the autoimmune autoimmune portion of Hashimoto's is to look at the triggers for your body. So how do you even find out if you actually need thyroid medication? Most physicians are running what we call TSH. That stands for thyroid stimulating hormone. This is a pretty basic test, and it's one that most physicians have heard of when it comes to testing thyroid. But TSH is not a thyroid hormone, and it doesn't tell us really anything about how well your thyroid is working. TSH is actually a brain hormone. It comes from your pituitary gland, and it is a stimulating hormone, so it tells your thyroid to produce T4. But T4 doesn't tell us the whole story either, because T4 still has to get converted into its active form, which is T3. And even that doesn't tell us the whole story, because then that T3 has to make it to the cells of your target organs, which is basically every organ of your body, and it has to be taken up at a proper rate, bound to those receptors, and converted into what we call free T3. A lot of doctors will test for free T3, but free T3 is a really difficult marker to get an adequate idea of how much is in your body, because it's inside of the cells of your organs. It is not out in circulation in your blood. So when we're testing blood hormones, what we want to look for at bare minimum is TSH, free T4, which means it's unbound and available to be converted into T3, and then total T3, which is bound to a protein in circulation in your bloodstream, but hasn't yet been taken up by the cells of your organs, so we can get a little bit better of an idea of what that conversion rate is like of T4 to T3. So that's how we look at the hormone piece of this, which is mutually exclusive from something like an autoimmune condition. Hashimoto's is not the only autoimmune condition you can have against your thyroid. You can also have positive thyroglobulin antibodies. These don't have a fancy name, but what this means is your body is now attacking the protein, globulin, that carries thyroid hormone around your body. Again, this leads to an awful lot of destruction of thyroid hormone and can end up leading to a hypothyroidism, but that is not a guarantee. We also will test patients who are in hyperthyroid flares for something called TSI antibodies, and these antibodies are telling us whether you have a disease called Graves' disease. It is very common to have Graves' disease and Hashimoto's at the same time. Most patients who have Graves will have positive Hashimoto's antibodies as well. However, patients who have positive Hashimoto's antibodies don't always have positive Graves' disease antibodies. Graves is definitely a less common form of autoimmunity against your thyroid. Some additional tests that you want to look for, but you really need a physician who knows how to read these, are things like reverse T3 and T3 uptake. T3 uptake tells us how many receptors are available for our total T3 to bind to. There are things that can affect T3 uptake, like estrogen dominance. And then we want to look at reverse T3. Reverse T3 is what gets converted from T4 when your body has too much T3 in circulation, or if your body is under stress. It's kind of the way that your body will regulate metabolism. So if you're in kind of a hyper flare, your body will start sending a lot of its inactive hormone over to reverse T3. This can actually feel like a hypothyroidism, even though you have plenty of hormone in circulation. Again, it's great to run these panels, but you really need to know what you're looking at and what the reference ranges should be. Not all thyroid hormone medications work the same. Let's break them down. First of all, we have kind of our first line of treatment for hypothyroidism, which is called T4. Levothyroxine is a really common name for this. Synthroid is another common name as well. So what is T4? Well, T4 is your inactive thyroid hormone. It's what's produced mostly by your thyroid, but T4 has to get converted over to T3 in order to actually be used by the body. So why could this cause a hypothyroidism, and how could you be on this medication but still be feeling awfully hypothyroid? Well, because your body requires an awful lot to be able to convert T4 over to T3. First and foremost, it requires an abundance of nutrients, which means you have to have really good absorption in your GI tract, and you also have to be eating a really adequate diet. T4 also requires thyroid peroxidase in order to be converted into T3. So if you create an antibody against thyroid peroxidase, you're going to be kind of working against yourself as far as that conversion goes. So you could be taking T4 and your doctor could be increasing the dose and increasing the dose and increasing the dose. But at the end of the day, if you have an inability to make a conversion from T4 over to T3, it's not going to do anything to fix your hypothyroid symptoms. There's also the option to just take T3, but Dr. Britney, why don't we just take T3 if that's our active version of this hormone? Well, one of the reasons is because T3 is very metabolically active. What that means is it has an incredibly short half-life. It only lasts about 4 hours in the body. So if you wanted to take T3, you'd be dosing it multiple times a day. It's nice to give your body T4 because then your body gets to decide when it wants to make that conversion all day long. Sometimes though, we have to give both. So a lot of times patients who are on T4 medications, and I can tell that their body maybe is converting about half of that over to T3, I'll give them a little bit extra of a dose of T3 and I will dose it a couple of times a day, and that usually gets things taken care of. There is always the option to go on what we call a desiccated thyroid. Desiccated thyroid brands like Armour and NP Thyroid are broken down thyroid from a bovine or porcine source, and those will have actual T4 and T3 in them. If we have dialed in your medication dosing, which I like to do separately first. I like to do T4 and T3 so I can really dial in those doses. If we have found one that works for you, then usually we can make the conversion over to something that's a little bit more bioidentical, a little bit more natural, and something that you don't have to dose multiple times per day. There are also options like glandular medications, but glandulars aren't always standardized. It's really important that you have vetted the company that you're getting this supplement from. These do not require prescriptions, but I would never recommend that you add a supplement to your regimen, any supplement for that matter, without consulting with a physician who knows exactly what your deficiencies are and knows exactly how to dose that supplement. If you're noticing that you're still symptomatic despite the fact that you're taking a thyroid medication, it's worth looking into your conversion rate and making sure that you're on the right one, or maybe you even need a combination of a couple of different kinds. If you're still feeling bad on thyroid medication, there may be a few different reasons why. Here are some things to look out for. The most common symptoms of hypothyroidism are fatigue, constipation, and weight gain. Now, those three things can come from a lot of different places, but generally, if you know that you have hypothyroidism and you're still experiencing those things despite the fact that you're on thyroid medication, that's a pretty good indication that you are either taking the wrong dose or the wrong type of medication. Some hyperthyroid symptoms that we see often when someone is in a hyperflare with their Hashimoto's, or when someone has another autoimmune condition called Graves' disease, would be things like anxiety, tachycardia, which is an increase in your heart rate, particularly when you're trying to go to bed at night, sweating, diarrhea is a really common one as well, just kind of this general feeling of angst and anxiety, perhaps even panic attacks. If you're feeling hyperthyroid and you're on thyroid medication, and I'm not talking about methimazole, which is a suppressive medication for patients who have Graves' disease, but if you're taking a thyroid hormone replacement and you're having any of these hyperthyroid symptoms, that is a sign that you are taking way too much of your medication, that your doctor either didn't know how to dial that in or did it too quickly, or that you're in some kind of hyperflare. And in those scenarios, we really want to do a deep dive into your blood work, because first of all, if we take you off of that medication, we can throw you into a hypoflare, so we have to be very, very careful about that. Also, we have to evaluate, is this just a flare, or is this your thyroid actually being quite productive and you don't need to be on thyroid medication at all? One of the things that you can do is track your symptoms. Keep a journal every day of the way that you're feeling. This will help you advocate for yourself when you go to your physician and you tell them, I think I'm on the wrong medication. The wrong thyroid medication doesn't just make you feel bad, it can have some long-term side effects as well. If you're in a hyper state for too long, you can end up throwing off other hormone balances in your body. This causes a lot of adrenal fatigue because your adrenals are constantly trying to keep up with this internal stress response. If you're on too low of a dose of medication, the side effects are very wide-reaching. You can end up with serious leaky gut issues and malabsorption problems. If you keep in mind that thyroid hormone is responsible for cell metabolism, which means telling the cells of your body to do their jobs of every organ of your body, we can start to see kidney failure, which is really common, liver failure, liver damage in general, and just a lot of GI issues because T3 hormone is responsible for maintaining the integrity of your intestinal wall. Regular testing of your TSH, free T4, and total T3 for people who are on thyroid medications or people who have Hashimoto's is absolutely necessary. And when I say regular, I don't mean every 6 months or every year. I mean, let's do this every 3 months and make sure that we're meeting consistently in between so that we can track your symptoms and catch things early. You don't have to settle for just feeling okay. And it's not just a matter of I'm tired or I have kids or I have a job or a husband and all of these different things. You need to feel your best at all times, and if you don't, then that is putting extra stress on your body that it doesn't need. Don't settle. If you're not feeling your best, make sure you talk to your doctor and make sure they're running the correct labs. I know a lot of this can sound overwhelming, but it doesn't have to be. I've created a few free guides for you so that you can look at what type of testing is appropriate and what the different medication options are for you. Please check out those resources in the description below. Are you struggling with thyroid symptoms despite being on medication? I want you to drop your symptoms in the comment section below. I read every single one of them, and oftentimes I can give you some actionable steps that help you to feel better. Make sure to watch my next video for more insight on your thyroid and how to feel better. Click the video on your screen now, and I'll see you there.